Nitrates are a rather confusing topic. So, in terms of how nitrates are working, it's important to be aware that they're an excellent anti-anginal medication, and they're used in people to relieve chest pain during ACS and stable angina, which most everybody is aware of. So, how do they work exactly? So, the way that vasodilators or the way that nitrates are, they act as vasodilators. So, you can see here we have a normal vessel, and then once you give the nitrates, what happens is that there's vasodilation. And that vasodilation occurs in veins, it happens in arterioles, and it also happens in the coronary arteries by relaxing the smooth muscle vasculature cells. So the primary way that nitrates actually act though as an anti-ischemic is by reducing systemic or by with systemic vasodilation rather than coronary vasodilation. So systemic vasodilation is going to lower, and this is important here, it's going to lower the preload, and then it's also going to lower the left ventricular end diastolic volume as well. And then in doing so, what happens is that there's a decrease in O2 demand, myocardial O2 demand, through reduction of wall stress. And the other mechanism through which nitrates work is the fall in systemic blood pressure. And that fall in systemic blood pressure is going to reduce wall stress as well, thereby decreasing myocardial oxygen demand. Now, nitrates can be a little bit tricky to use, so here are a couple of key points to keep in mind. So nitrates do not have any direct effect on heart rate, but they can cause reflex tachycardia, so you have to be cautious when using them with a beta blocker because the person can develop reflex tachycardia, leading to an unfortunate increase in oxygen demand. So if you increase oxygen demand, that makes the angina worse. And then, what else you need to, the other major point is that nitrates also have no impact on contractility or left ventricular compliance. And that is all for this summary of nitrates and how they work in reducing coronary pain secondary to ischemia.